Yeah, we haven't done. Oh, we are live. Oh, thank you. Okay, health and welfare back again, and we are picking up on H91 with testimony from Department of Children and Families and others. So, Commissioner Winters, thanks for being here.
Good morning. Thanks for having us.
I'm going to ask this question. You have folks here with you, and do you have things organized? And we just have people listed. Do you have a specific?
Yes, ma'am. What I thought I would do, and always subject to the chair's direction here, but I would make broad comments on H91, some of the pros and cons that we see with the bill. I think a lot of it will reinforce some of the testimony you've already had from some of the community partners and community action agencies. Then I have Deputy Commissioner Miranda Gray here, who can talk about the General Assistance Emergency Housing Program, the hotel motel program, how it's evolved since 2020 or so, the last 5 years. We have a slideshow that kind of point out numbers of people that we've served and the cost and the different changes that have happened. It's changed many, many times the last 5 years. And also here is Director of the Office of Economic Opportunity, Lily Sojourner, and she'll talk about the HOP program, the Housing Opportunity Grant Program, and how that has evolved and how we've invested more in the shelter system over the last 5 years as we've seen the need for it arise. If that's all right with the chair, I'd do that. I'd give some broad comments and then turn it over to Miranda for GA and Lily for.
Perfect. That's perfect. No help. No, just go from one to the other and we'll listen.
Great. Thank you very much. For the record, my name is Chris Winters. I'm the Commissioner of the Department for Children and Families, and appreciate the opportunity here to comment on H91. As H91 passed the House, it would really change the way in which we address homelessness in Vermont. It's I want to give the House Human Services Committee a lot of credit. It's a bold idea. It's a big step. It proposes replacing both the GA emergency housing and that Housing Opportunity Grant Program, HOP. Replacing them both effective July 1st of 26 to be administered and overseen by DCF, but operated by the 5 community action agencies with a set aside for a statewide entity that provides services for survivors of domestic violence. That's a huge shift. And I think over the last couple of sets of testimony, you've heard from community action agencies and others talk about the programs and the services that they provide with HOP. Some really effective work and some amazing things that they do to seriously help people who are experiencing homelessness, prevent them from entering homelessness, and divert them from being homeless. So there's a lot of merit, we think, to the idea of bringing this sort of service and decision-making closer to the local communities that are most impacted. By doing it regionally, you can tailor to the needs of the different regions of the state. Each region being very much different in their approaches. We've experienced that over the last several years. Of Rutland might want to do things a certain way, and Chittenden County might want to do things another, and Brattleboro might have different needs. It really presents an opportunity for us to unify with fewer providers in each region, maybe coordinate the services and maybe have them be more effective that way, as opposed to the hotel motel program that we have. So you hear all the great things about HOP. You probably hear some equally not so great things about GA. We are sheltering people, but are we really servicing them? Are we really helping them? Are we really helping them move towards something more permanent and helping them get on a path out of homelessness? So this, I think, that's another great benefit of this bill is I think we all recognize we need to try to turn away from the hotel motel program as it's currently run and turn to something different, something that will actually work. And then, of course, the devil is in the details of all of that. How do we get from here to there? What's the appropriate timeline? What's the transition? What are we expecting of community action agencies in this? What's the future of using hotels and motels? We all think we really shouldn't be using them, but we should be using them in a much different way. The bill as it's written is largely a planning bill. So in the coming year, we work with a very large advisory task force with a report due in February of 2026 back to the legislature. So that timing isn't going to move us along very quickly. There is a lot of planning to take place, but there are some steps we could take now. We could start taking in the coming year to move us toward where we want to go in fiscal year 27, fiscal year 28. So if we were to just plan for the next several months, present recommendations on February 1st, I think the vision is that then the legislature would take it up, would debate another bill, pass that bill sometime in May, and then have that go into effect on July 1st, like May 26th. That kind of stretches the timeline. There's a lot to do between now and then, but there are some things we can start doing sooner. What we want to do is ensure that we make some progress in the coming year in a way that it gets us further away from the hotel motel model as it exists and moves us more toward those successful shelter type models that you've heard about that are funded largely by the HOP program. The other parts of this bill that are concerning is that it's not very explicit about how to contain costs or how to reduce hotel motel use. It leaves a lot to be determined about the responsibilities of guests, about identifying all the core services that we want to make sure are provided, or it doesn't allow for prioritization of populations to ensure that if we can't serve everyone, that we successfully serve the most at risk. So we would propose, and we're working on this language, and we don't have it to propose just yet, but it's a swifter transition away from the hotel model through eligibility, through prioritization, through creating a more robust front door, like making the entry point more effective. That means that we really assess what the person needs and hopefully can tailor some case management for the individual, facilitate the services that they need, set benchmarks for moving away from hotel motel over the next couple of years. What can we actually put down that says we're moving away from GA and we're moving into the HOP model over the next couple of years? And I know there's a lot of nervousness among the community action agencies, understandably so, that HOP is working well. Let's not mess with it. How do we separate HOP from GA and then start dialing down GA, dialing up HOP in a way that works and serves the people we're trying to serve. Some other pieces that we would propose is requiring client participation in case management, improving that facilitation services, setting benchmarks to move away from those hotels, because as I think most people would agree, our primary and ineffective means of providing emergency shelter right. So for an effective transition away from the state-run motels in the coming years, we want to make sure that we're talking about transformation. It's not just repeating what we're doing now through DCF on a local level with the hotels. We have to rethink how we're using them now. And what we'd like to do is make some progress in this year so that when we hand over some form of GA to the community action agencies, it's in a more manageable state. It's a smaller size, and we hand it over with clearer expectations about what are the core services, who we're trying to serve, and what are the desired outcomes. And I did just want to take a minute to recognize that it's chaotic right now in the general assistance program. We have said many times that we need a lot of lead time to plan for and execute on changes to GA program. And you'll hear a little bit from Deputy Commissioner Gray, like how many times it changes. Seems like every few months, definitely every year. The rules change and we have to roll out new rules. We have to do our best to communicate to the folks who are using the program. And with this executive order, without an agreement between the administration and the legislature, in the Budget Adjustment Act. Again, it got dropped on everybody at the last minute, and that's created a lot of turmoil. And I just want to acknowledge that's really hard for people who are trying to understand if they're eligible, where they're staying the next night. People are being exited, people are qualified and coming back in, and we're doing our best within the Economic Services Division in DCF to make sure people are eligible and getting the right people into hotels they're qualified through July 1st. It's been really difficult. I just want to acknowledge that that also ends up meaning that a lot of our community partners and community action agencies and folks providing services are picking up the pieces for that right now. And what we would love to do is get ahead of this, talk a lot in DCF about getting out of crisis mode and getting upstream and getting to people before they're in crisis mode. And we would love that to create a pathway, whether it's through H91 or the big bill language to transition to something different. That's, I think, what House Human Services was envisioning here. I just think there are some ways that we can do it. Making some progress this year and moving a little bit quicker than what's described in the bill. There's still a lot of detail that's not spelled out. It needs it to this implementation committee and to DCF over the next several months. We'd love to see some of that spelled out in the bill language. So just, I guess in closing, before I hand it off to Miranda to talk about GA, and just, you'll see in her slides, and I'll think about how much we've spent on hotels and hotels over the last 5 years and what we've gotten in return. It's certainly helped people. It's certainly put a roof over their head. But has it helped them be money? And just think about what it might look like. We shifted that spending from hotels and motels to more traditional shelter models for the kind of programs that are supported by HOP and administered by the community action agencies, by the many providers, the state, instead of sending that money to private hotel owners. We don't have a lot of experience working with these kind of populations, or don't really, they don't have the responsibility or the interest to help people move forward in their lives. So with that, I would answer any questions that you might have, or turn it over to the deputy.
Well, probably will be questions. And I know that some of the questions we asked will maybe answered in subsequent testimony. Would be helpful to have your introductory remarks to keep these so we can.
We can do that.
Senator Brewer has a question.
So much, Madam Chair. Thank you, Commissioner Winters, for being here. I know this is hard work and I really appreciate all you're doing. I live in Burlington, so I also feel the need for urgency and for speeding things up as much as humanly possible. So I really appreciate you highlighting that. We are definitely in crisis in my community, and I hear from my constituents regularly about what folks are experiencing, especially downtown. I guess my question has to do with it's pretty broad, but I have to bring it up because it keeps coming up. Prioritizing populations, and I heard you say the right people, and this is our committee is science, right? We deal in science. And we also talk about the social determinants of health. We talk about brain science. We talk about all these things. And I know we all believe in self-determination and that, we all have control over our fates. But the more we learn about brain science and the social determinants of health, the more that becomes a gray area. And so we had a debate on the floor. Why are you prioritizing women in their third trimester when the first trimester is actually the most dangerous period in a pregnancy, frankly, and the most, difficult in many ways. So I'm just wondering if you all use science in your determinations as to who gets prioritized. And I also want to understand, and I understand that I'm sure there are folks who take advantage of the system. I don't want to, but generally speaking,
Yeah, thank you for the question, Senator. Saying, I didn't realize that I said the right people. I think that was an unfortunate turn of phrase. But what I think, what we're trying to get across is that if we have a limited resource and we do have to choose, no one wants to make these choices. Let's be clear. These are human lives and balance. If you can only help so many people, how would you create that list of who's first? We do have a position. We did consult with the Department of Health and Dr. Levine in one of our rounds of prioritization of who are the most at risk from living outside. What we're doing now, we've looked at this medically vulnerable category that's in the executive order. We consulted with medical team in DEPA within that agency of human services, and then making some terribly difficult choices about who, based on the resources that we have. So that's what I mean when I say, if we can only help so many people, who are the people that could most benefit from it, who are the most at risk. And no one wants to have to make those choices. That's why it's, I think, only many years now, it's been a very difficult decision in the legislature to say GA has to be this size. I think we have to wrap our heads around the fact that we cannot help everyone. We never have housed everyone who needed housing, and it's very unlikely that we ever will. But how many people can we help, and how effectively can we help them? Like putting a roof over their head and putting them in a hotel room, or can we serve fewer people and wrap them in services to get them out of homelessness permanently? Those are the really tough decisions that have to be made around the bill like this.
I also want to just agree that I would like to see the One Health program eventually go away in favor of a much more robust, stable program.
And just thank you. I appreciate that. We just know that it's a more expensive model. We know that. And so if we have a certain number of dollars to deal with this, and we want to do that more intensive model, possibly we would have to focus on big people. Since the
Senator Cummings. Yeah, I live across the street. The shelter. I think the thing that made the biggest impression on me yesterday was in this breakneck had the breakouts of how many people, and it was people with mental illness, people with addiction, people with, and in here somewhere, there are some people that just need housing. They're in control of their mental issues, or they just need a warm, stable place to live, and they'll be fine. But I think the problem I have is I'm not sure putting boots on the ground to figure out how many people in that motel down the street from me have serious mental illnesses, have serious addiction illnesses. How do we get them? And I understand some, if not many of them, don't want help. Probably a lot of them look like young, able-bodied people with the signs. They're down in front of the co-op every Sunday morning, and down in front of the grocery stores. But how it gets to be resources. I'm not at all sure, because I know you all support the governor's budget. If you were resourced enough, I know we didn't have resources enough to answer the phones, to extend people's stay, and we had to hire outside people. It's what kind of resources do we need to get? Because just building most housing is not going to help
many of these people. I was on the category for 10 years. They've been doing it for years. Budget counseling, housekeeping counseling, keep from getting evicted, because yes, you do have to pay your rent. And maybe, how you do make spending decisions, how you don't damage your apartment, how to get, help people get into them. But I'm not sure they're resourced enough to deal with people with serious mental health or addiction issues. And I'm quite sure we aren't resourced enough to deal with that. And I guess the thing I need at the beginning is what do we actually need to do this? Because until I know that, I don't know what kind of budgetary decisions we're making. What would it take to get? I mean, there's a lot of nice cars parked in front of that motel. At least they look nice. I think one's dead. It's been in the field for months. But who was responsible for actually interacting with the residents? Who was responsible? I know home health goes up. I know we've got some social workers. So,
Senator.
I mean,
I think what the questions you're asking are, hopefully, we're going to put this into context
okay.
with our next testimony. Correct me if I'm wrong.
Yes, some of it.
Some of this, right?
It's a very big question you're
Yeah,
asking,
it
but it's about.
Like
root
humongous.
cause.
It is about
Yeah.
or
So my suggestion is let's listen to the testimony here. And if one of your questions is not answered, and because I think you've asked a lot, and they're really important answers that we need.
I just say very, very briefly, Senator, if I could. That those are really big questions, and it goes to root cause, and just remind everyone that the GA program is really designed to be that safety net, that catch-all for folks who don't have anywhere else. And it grew since 2020, since there's been a affordability crisis, a housing crisis, mental health substance use, and some of those services that you're talking about, we cannot deliver in a hotel. So I really think that's part of what we're talking about, is how do you shift away from that and maybe the appropriate reinvestment GA dollars is traditional shelters with those kinds of services. Maybe it's mental health, maybe it's substance use disorder. What are the places that we could spend the money better than
Back real super quick on what Senator Cummings was asking, because I would also like to hear what is the cost of not housing people? A city councilor in Burlington told me just the other day that Burlington spent $8 million just on some latrines or outdoor facilities, and some blankets and some, that's $8 million in our municipality. So what is the cost of not doing this? I think that needs to be factored in.
definitely a part of the equation.
the viability of our
It's impacting the emergency departments, our schools, the list goes on and on and on.
$8 million for training. So what is
I'm not gonna have this conversation right now. Yeah.
Okay, so I think you all have heard the questions and the concerns. So as we're going through the testimony, we'll, if it's possible to weave the responses into that, into your testimony, that would be great. Otherwise, we'll hold those thoughts and come back to them for a general discussion. All right. Thank you. And just FYI, every part of the state is different.
But I don't want to be questioned on what I'm saying that I heard from the city councilor. Like maybe.
No, you're not, no, that,
it's just.
I said, and other things. I said, this means blankets and other necessities.
What's the big cost?
Okay,
Sorry.
it seemed like it was.
Morning.
Good morning.
For the record, Miranda Gray, the Deputy Commissioner of the Economic Services Division. I'm gonna go quickly through the first couple of slides, and then I'll get into some of the history, and then also some of what I have to share will explain somewhat of how the program has been able to expand as well. So just the General Assistance Emergency Housing Program sits within my division. Quick overview of the agency of human services, and very appreciative of our sister departments who have really come to the table with us to help us be able to serve the Vermonters that are in the hotels and motels. So I'm going to start here on slide 4. And I'm going to start with the pandemic, and then I will go in a slide or two into pre-pandemic, just to give you a sense. I think the commissioner has mentioned we have had a number of rule changes, and it is challenging for everyone that's involved. So in March of 2020, it was the stay home, stay safe, and the J program rules were waived in their entirety. And really, what we were trying to do was get everyone inside into a room that we could, so that the spread of the COVID was lessened. We were successful. Vermont was very successful, and it's nice that we should always pause and celebrate that we have had success. It did not have the super spreader in shelters. Yes, we have done exceptionally well. So that was very exciting. In 2021, adverse weather conditions, which was part of the General Assistance Program, switched to being day to day. Prior to this, it was night to night. So my division was looking at the weather as a factor of both temperature and the precipitation and determining, and it really did depend on where you were across Vermont. So there might be a couple of district offices that would have adverse weather conditions called for the evening. There would be others that weren't. In 2021, we said it's a block of time, and which is what we have operated under for the last couple of years. And some of these, I was not with the division at the time, so you'll have to forgive me if you want real details on some of these programs. I'll have to get back to you. But the Transitional Emergency Housing Program began, and so we received different pandemic funding sources to be able to run different programs here as well. So that was one of the programs, the Transitional Emergency Housing Program we were running. In 2022, our Care Coordination Housing Review Teams were implemented. And so this was across the Department of Aging and Family Living, Department of Mental Health, partners out of the Agency of Human Services, our Vermont Chronic Care Initiative nurses. We came together, and this was, as Senator Cummings was asking, who was going into the hotels to do an assessment to truly understand what did people need, and was it really they just need a voucher to be able to make housing affordable, or do they have other barriers that needed to be addressed and help? We did do this. It was reallocating staff that had other jobs to be doing. And so in my shop, I had some people who were supposed to be determining benefits. So for Resource Vermont, Reach Up, Fuel, etc., we had to say, we'll figure that out. We need you to go out and do this. And so that was also a little bit of a stretch, I think, across all the departments that were doing this. In November of 2022, adverse weather conditions was implemented with some relaxed rules. Then in March of 2023, adverse weather conditions was extended until June 1st of 2023. June 1st came, adverse weather ended, but then in June, also later in June, Act 81 was passed, and this created a new cohort, the June cohort, and they were guaranteed to be able to stay in as long as they continued to meet eligibility. And there was a lot of rules around this until March 31st of 2024. The eligibility in July, eligibility criteria changed to allow households with children under 19 and under 19 and under to be eligible, and applicants who were between the age of 60 to 64. No pause there. Sure. You have a
My question, as I go through this, I'm just, it would be helpful to know when federal dollars ended.
And I might have to get back to, because there are
Okay.
certain ways and understanding. I want to say, as we were getting into 2023,
Yeah.
that is when we didn't have, that were some carryover funds. And so that would have to come from the business office to give you an exact date. But yes, we
In
have,
that area.
yeah, in that area. So then, we get into, or just a little bit over a year ago, through the Budget Adjustment Act, we extended the June cohort. So that group that had been in potentially housing since, the end of June, we're going to be exiting on March 31st. We're able to stay until June 30th. So we do have some households who have had a fair amount of time in the hotel and motel program, and some with breaks, and then some, you know, just because the state stops paying for someone stay does not mean that they necessarily leave the hotel. So we know that we do have some households who have been living in hotels for a number of years. And then we get into July 1st of last year, and then that's when Act 113 came into place. Getting more into present through Act 113, the adverse weather conditions also had changed. We used to have a night-to-night component on either end of the season. And through Act 113, we said, you know, we're going to have a firm start of December 1st. And then we would end on March 31st with people exiting the morning of April 1st. On March 28th, as you're all aware, the executive order was issued to allow the most vulnerable Vermonters to continue to be housed through June 30th of 2025. That's a quick where we have been in the last 5 years. Yes, all over the place. It has been a lot of changes. We do make mistakes a lot of times just because we're going on the fly. We're trying to implement. I will say, and I want to give my team, kudos is on March 28th when the executive order came out. That was around 2:33. By 6 p.m. that evening, we had letters to hotels to put under participants' doors, because that's the most effective way for us to be able to communicate changes, letting them know what the change was, and that yes, we would be open for business on that one day to be able to engage with them. Were they able to stay? That was the 31st. Now I'm going to go just back a little bit before 2020. And here are some of the changes. So it used to be pre-pandemic that we only engaged with people who were eligible with GA in person. So you had to come into one of our district offices. We made this change to being engagement over the phone during the pandemic. We also verified closeness. So if you said, I stayed with mom last night, but I can't stay with mom anymore, we were calling mom to say, are you sure Miranda isn't able to stay with you anymore? And that went away. Eligibility was also determined based on a category. And depending on what category you were in, was determining how many nights you were going to receive. The catastrophic for 84 days, vulnerable for 28 days, and then adverse weather conditions. Adverse weather conditions pre-pandemic was always night to night. And key components.
As the slide just disappeared.
Zoom is trying to let me back in. I apologize if this has happened. Now this is the 3rd time, so hopefully I'll get back.
This has been happening apparently.
We
had
had
having
a
issues.
yesterday, the
Yeah.
room was completely down,
Yeah.
and we can't have a meeting unless we're.
We're still alive, so we are
still
Zooming.
alive, okay.
Oh, it's just me.
Yes, just you.
Just maybe you can.
Okay.
I'm gonna share. Dr. Sojourner is going to save the day here.
Okay.
No pressure.
No pressure. I'm not
Don't put it the wrong button.
but now. I will continue to go.
Oh, there we go.
And I'm on slide 6.
Okay. Slide 6.
Thank you. You're a great team. I'm gonna just let it keep spinning in front of you. We'll see what happens. I'm afraid to do anything different. If you want to just. Sure. Actually, yeah. So the other important piece of pre-pandemic is that if a shelter bed is available, the applicant was required to accept it and was sent to the shelter for intake. This is maintained. Vermont is a shelter first state, but we used to have more availability of shelter beds as well. So, and I think this really, I have mostly covered this already. You know, just like in-person application, but during COVID, that is, as I mentioned, where we had. I'm just gonna shut it down. It is not happy with me at all. That is where we started transitioning. Homelessness was not verified. The applicant just needed to state that they needed shelter. There wasn't necessarily any eligibility criteria. Everyone who needed shelter was helped. That was during the pandemic. I guess this gets into a little more detail, all of the different acts that happened, which correlate to the different programs, or whether being extended. That I'll keep going. I'm sure that you'll have questions here as well. So transitioning out of COVID into state fiscal year 24, we still allow people to engage with us. Most people choose to engage with us over the phone. But if someone goes into our district office, that's absolutely fine. We do take someone in and then we still call our housing line. And so if someone needs assistance with that, we are happy to help them. If someone just needs the phone, we have phones in our district office that will allow people to be able to engage in that way. Homelessness was verified again. And then the eligibility was determined also again, but these categories. So we had catastrophic, we had vulnerable, we still had adverse weather conditions, but now we also had the June cohort. And so this was different. We were essentially, when it came to July 1st of 2023, we were running two different programs, and it mattered if you were in a GA motel room on June 30th or not. So if you came in on July 1st, you had to be catastrophic or vulnerable, and you were only going to receive the 84 or 28 days. Then we have a pretty significant change that happened last summer. What didn't change is how you could engage with us. The interviews were held by the phone, over the phone. But now homelessness is not verified again. You can just state that I don't have a place to be able to stay. I don't have shelter. You still have to take a shelter bed if it is available. The other major change, instead of having catastrophic and vulnerable categories, the legislation said, here are the eligibility categories. This is who we are going to house. And so that was individuals age 65 plus, which is the difference because it had been 60 at a point, have a disability. There was also an introduction in the Budget Adjustment Act, the variance form that was continued in Act 113. Maintain that children aged 19 and under were going to be served, pregnant, because that has been something that we have changed over various iterations of the general assistance program of what trimester, if that matter or not. I think those are really the major changes in the eligibility category. But then also it was defined the length of assistance, that it would be 80 days that people would be able to stay in, but then from July 1st to November 30th, and again from April 1st to June 30th. So only 80 days across both of those time periods. But then during adverse weather conditions, 80 days was not applicable. People could stay if you were in. And then we also had the introduction of 1,100 room cap. I'm sure many of you remember, the timing didn't line up. 80 days was not September 15th, it was September 19th. So on the 15th, we had to get to 1,100 rooms, and that was, we were serving about, I want to say, 1,450, 1,500 households. So we had 400 households who we no longer had space for. And then 4 days later, we had households who started to reach their 80 days. And then that went all the way through really into November, I want to say, that we had, just because we have a number of people who do have income, their social security income, but we have a lot of people who are also working that are are saying, and I think that gets to your point of like, it's the only thing that they need is permanent shelter. That's what their barrier is. So then we have the executive order. Again, that was issued March 28th. And this allowed for families with children. So if you were in a hotel on March 31st, you had families with children, but you had to have custody of the children. And this was only for those under the age of the child would be under the age of 19 to receive priority. Essentially, that just said if you'd already used your 80 days, you were still eligible to be able to stay in through June 30th. With a primary goal of less disruption for children, particularly those that are school age or those who might be enrolled in childcare. And we also, under the medically vulnerable, allow people who are pregnant to be able to stay in, and those who are in their third trimester. And the way this was applied is if you were going to reach your third trimester between April 1st and June 30th. Not that you were in your third trimester on March 31st. And then we have those that are medically vulnerable. And that is defined as individuals who are homebound, require a life-saving device that needs electricity, are undergoing cancer treatment, are receiving treatment from severe heart, liver, kidney disease, or receiving home-based nursing services. We were working, as Commissioner mentioned, closely with our sister Department of Vermont Health Access, as well as the Department of Aging and Independent Living and the Vermont Chronic Care Initiative nurses to understand who did we already know that we were housing and that they already had a relationship with. They knew that they met one of these categories. And so we were able to say, you're all set. We don't need anything additional from you because we've already had information from a medical provider or a professional that does that assessment. We also, of course, knew who we had for families. We had some sense, so we had also been able to see who were we serving that we thought might be medically vulnerable, but we were going to need information we were going to need to ask them and get medical records. And what we found is there are more people who are attesting to the fact that they're medically vulnerable. So we continue to work through that process. And we had to create a form, a new form for this. And so while the executive order became effective on that Monday, by that Wednesday, we had a form. So anyone we had engaged with on Monday and Tuesday, which as the commissioner had said, was really challenging. We had very long wait times on our phones. And this is an instance where we can't just add more folks to our phone lines who aren't trained. And so, but by that Wednesday, our phone lines had calmed down. They were back to what people expect of us now, which is seconds to a minute, of wait time. The medical form, the medical information that we were receiving is being reviewed by a clinical team. And that is with the professionals across Vermont Health Access, the Vermont Chronic Care Initiative, and the nurses, and then also the Department of Aging and Living. And then we also have some nurses who are able to help with this as well. Should I pause for a moment, or I'm happy to keep going, but this gets into.
No, it's just, we're with H91, we're trying to put a lot of the complexity of our history behind us and to look at what we can do for improvement. So it's important that you're going through this. That reminds us of the difficulty that we've all been through. Good. Well, move ahead.
But part of that difficulty or changes has been money. We've made the changes because of the lack of available funding. And I guess that's part of my concern, just to move the responsibility somewhere else without additional funding is not a good solve. Exactly. Complex. It is complex. But the reason we've been through all this isn't because anybody wants to put people out on the street. It's because we didn't have the money to pay for motels and we didn't have the shelters to put them in. It's not just that we didn't care. That and
Exactly.
that's
Here we are,
here we are.
right? And we don't want to be right back where we started. We want to be moving forward. Right, yes.
So with these people, it's gonna be worse.
Yes.
So this gives you a snapshot of where we have been in terms of the number of households that we have been serving over the last several fiscal years. As you see, it really was pre-pandemic. We served, a couple of hundred households here and there, and then during adverse weather conditions, we've got 350 households. So that we would see that increase, but has continued to really be quite significant since the pandemic. The total cost. And this is, with the various funding, a lot of pandemic funds to be able to help support the cost. I think of note the fiscal year 23 costs were significantly higher due to the operation of the transitional housing program. That was where we kind of treated hotel rooms more like apartments, and there was I'm thinking of the word that I'm looking for, a security deposit, component of this. I guess that was it for me, and then we would transition to what was happening kind of at the same time with the Office of Economic Opportunity.
So within all of the historical stuff that's going on, there were rules being written, emergency rules, and finally permanent rules that got approved in February for all of this. And one of the last sort of disagreements about the rules was eligibility criteria and financing. And if you have money, then you have to pay for you have to invest and pay for the care that you're getting or the room that you're getting. So there were two different populations in there. Can you talk about that eligibility requirement for the populations who were allowed to save and that those were not, and then they were put together to have to pay money into the care or program?
Yes, and I might need to phone a friend. So it was the vulnerable versus catastrophic. And there was, who had to help pay and who didn't. We have since at least 2023, July 1st, their income contribution. So that's also part of why people stay is extended, because we have some folks who pay for their hotel night at least twice a week because they're paid weekly. And so it's 30, we look at what 30% of your income is. And that's how we determine. It used to range greatly. I guess I should have highlighted that. We used to spend in some hotels upwards of $200 a night for people to be able to stay. And that was also something that was negotiated down last spring. And so now we only pay $80. I should say only because it's still significant, but we pay $80 a night now for hotel rooms. And so across the board, that is how we're looking at what people's income is. And I think you're right, through our rulemaking process, it had come up that people want people to be able to save money so that they have first less insecurity deposits. And that hasn't been how the general assistance program has run predominantly just because it is supposed to be the safety net. And so if you have income or you have resources in order that give you the ability to pay for your own hotel room, that is what we ask. And within reason, I know that and this can sometimes make it more complicated, but an example and one of the things that we don't have to think about now that it's getting beautiful outside is if someone said, I need to buy snow tires, we would take that into consideration with their income contribution because we want them to be able to get their snow tires so that they are able to continue their employment. It just wasn't, I have $9,000 in the bank and I'd like to keep $9,000 in the bank. So that is something that we went, we spend a lot of time with around the health card. And
Oh, yeah.
Yes. And then also, the prioritization policy. And that is another, important piece. In order for us to go from that 1,500 households to 1,100 in September of last year, we needed to make a decision about how we were going to do that. And so we had a prioritization policy. And we wrote that policy to be able to say, we can use this, anytime we were within 10% of the room count. And so we needed to use it, just for a few days this September. But then as we got into adverse weather conditions, we needed to use it. And as the commissioner had mentioned, over the course of our adverse weather, time, so December 1st until March 31st, we ended up with over 900 households who were eligible for general assistance, but we were never able to offer a room to. And so we do know that we don't have enough capacity. And so that was, why the department had put forward why we felt like we needed to prioritize to try to be able to get the most vulnerable households.
Thank you for that. I think what's helpful about this is it does demonstrate really, the human condition.
Who's next? It's Director Sochner.
Good luck. I'll do that.
Okay. Senator Douglas is paying attention to her schedules.
Okay, yes.
Thank you, Mel.
Thank you for being here.
Thank you.
Well, right ahead.
Good morning. Nice to be back. For the record, Lily Sojourner, the Director of the Office of Economic Opportunity. I did add a few slides in this morning from my presentation last week to help, I think, connect the dots on the Housing Opportunity Grant Program, or HOP, as I think it was frequently called yesterday. It was great to have so many providers in, to, I think, put a face to the name of what had been maybe a very high level conversation before. So it's not going to follow along in your slides exactly, but you do have this information.
Did you get the exercise to us?
Yes, absolutely. I'll get you
Yeah.
a revised
We're good.
copy. Thank you. So, again, we have a number of housing assistance programs at the Office of Economic Opportunity. Several one-time investments, which are listed below. We have a landlord relief program with Vermont State Housing Authority, a family voucher program, with Hampton Valley Office of Economic Opportunity. But the top are really our kind of core programs. We administer the Family Supportive Housing Program, which is intensive service coordination for families experiencing homelessness. We have providers statewide who work with families when they're experiencing homelessness, but then can also stay with them to help them retain housing. We just have launched a permanent supportive housing assistance program, which operates the same way, but for a Medicaid eligible population. So people who have maybe mental health disorder, substance use disorder. And again, very grateful to be able to leverage Medicaid for those populations and provide long-term supports and services. Our biggest program, though, is the Housing Opportunity Grant Program, and I will get into a summary of all that includes. This is and currently our notice of funding is out now. This is the umbrella program that really supports the state-funded network of homeless and those who are at risk of homeless service providers in the state. That includes emergency shelters. So for instance, we've heard from COTS, Memorial Community House, they all apply and receive funding. We have a few transitional housing projects. This is really deemed appropriate for very specific populations. So young adults is one where this is a demonstrated successful model. We have some programs. Rapid rehousing is the term, to kind of help folks move quickly from homelessness into their own rental situation where they can get services and some rental assistance. We do homelessness prevention. So I think that's really important too, to keep in mind that we're not just serving those through this program who are homeless, but we're trying to stem the tide and impact those who are at risk. I talked a little bit about coordinated entry last week, and that again is the process by which folks go through an assessment process that really does allow for the identification of substance use related needs, mental health, and the data that Frank Connect shared is gathered through that process. And that then allows the local community, when they're reviewing that list, to identify what other referrals might we need to make to help the individual be successful. And again, so through HOP, we provide funding to help support that process. We support flexible financial assistance. So this includes things like security deposit, having one or first and last month's rent is a big chunk of change for folks that they might not have readily available. And so we wouldn't want that to be a barrier for someone getting into permanent housing. We can support that, as well as things like if someone gets behind on rent, maybe they lost their job for a month or two, and we can help get them back on track. And then the homeless management information system and the comparable system for domestic violence agencies. So it's quite the array of funding. It does allow us to streamline the application process for our providers, so they don't have to, for instance, again, thinking about COTS, they're not just a shelter. They also provide a lot of housing navigation supports and services. So instead of COTS having to apply multiple times for different types of activities, they can have one consolidated application. And so yesterday, when folks were talking about how this is the array of services that they were talking about. So this current year, it's approximately $38.9 million awarded to 35 nonprofits. This does include the additional 10 million that we received in one-time funding last year. I included the link to our award summary. You can go and see exactly what we're funding in each of your communities, or in any community you're interested in looking at. I think I shared this as well last year, that just demonstrated the significant growth in the state fiscal year 25. It grew it as well. On my list to get the slide updated, and then constantly don't have an updated for you. So I need to remember to do that. And again, we appreciate that growth. And I think that demonstrates a commitment that the administration and the legislature has given to this problem. Again, you can see really the uptake in the years as we've been recovering from the COVID-19 epidemic.
No, go ahead.
Thank you.
Yeah.
I mean, this is really helpful. I'm just wondering, in terms of like, mainly one of your previous slides talking about housing and rentals and so on. Do you all ever do any advocacy around rentals and renting reform in terms of, I don't know, Just Cause, for example, or just putting some guardrails on rental prices and so on? And I'm asking this only because it seems like in our country, much more so than many developed countries, we can we allow folks to become fabulously wealthy on the backs of renters. And I have nothing against people making money with rental units, but it seems like in a time of a dearth of housing, for people to be building fabulous wealth in the rental market, it just seems problematic. So I'm wondering if you all do any work with the legislature or work with municipalities around rental reform.
So I see that Sean Gilpin is on your agenda later, and Sean may chime in either now or later too. I will say that the Agency of Human Services works very closely with their colleagues at the Department of Housing and Community Development. We work very closely with Vermont Housing Finance Agency, Vermont Housing Conservation Board, Vermont State Housing Authority, and that just right to talk about what is a healthy home ownership and rental market, and then to strategize together. That's not necessarily a space where Agency of Human Services is the lead, but we really do coordinate. We also do make sure that there are some safeguards in terms of the investments that we're making. So landlord relief program is an example where Vermont State Housing Authority receives a majority of that money through us at the Agency of Human Services. And that has some safeguards in it where it can only be accessed for tenants who are exiting homelessness or have like a voucher. So you couldn't use it, for instance, if, 35-year-old wealthy tenant destroys an apartment and they don't have rental assistance, they're not exiting home, you couldn't use it. Also, there are affordability guidelines and some protections built in terms of lease requirements in that program. So again, trying to help support healthy property owner tenant relationship.
Thank you. Appreciate that.
Yeah, thanks for the question. So the majority of our funding does go to emergency shelter. And then financial assistance is the second largest pot of funds. But again, the rest, you can see we're paying for a number of supportive community-based services. And then I did this week, in response to some of your questions last week, wanted to go dive deeper a little bit more into emergency shelter capacity. So this is our current capacity by community. And we're currently at 656 household capacity. So that is a combination of capacity for singles. Some of these shelters, a household is a household of one. For some, it is a household that includes children. It can be hard to tease that out. For instance, if you think about a domestic violence shelter where they might be dealing with a single individual coming into shelter who would take up one bedroom. They might be dealing with a single individual with 3 kids who might be coming into one bedroom. So this is a household capacity, not necessarily individuals.
This is what's currently this is total. So for Chittenden County, there are only 192 for the whole county.
And Rutland only has 24.
Oh, fine.
Washington has 120.
And so, I have another slide. So we'll talk about this for the next few slides. So if people have questions, just jump in at a time. This sort of breaks down the types of shelters that we have. So the majority operate year round. We have 4 that are seasonal shelters. Yeah.
Just to ask the question, I think that underlies Senator Gulick's observation is that with all of the huge amount of money that's been invested, the amount of money that's been invested has not actually gone to new shelters or because we're a shelter first state, right? Theoretically, but the money has been invested in rent, hotels, motels. I'm making a statement that you either confirm or deny. Well, the GA budget, right, does not go into hotels. I mean, it does not go into shelters. Doesn't go into shelters. So a lot of all the money that we've spent has gone into private organizations. Literally. The hotel. Yeah, okay. I think people need to understand that. So perhaps there's been a resistance on the part of the business community to resist moving away from hotels. I don't know. Anyway, we'll just leave that thought out there.
So this slide breaks down just a little bit more about the types of facilities. A majority of what we consider semi-congregate, where folks have a level of privacy, but maybe sharing bathrooms or kitchens. Many of our shelters are, renovated old farmhouses. This one could imagine. So people have their own bedroom, but then maybe some shared living space. Nearly a quarter are focused on those experiencing domestic violence. And then you can see at the bottom, just like what are the household compositions that we currently serve. And this kind of captures our growth like pre-COVID to where we were now, because it has really changed kind of dramatically. Pre-COVID, we were serving around 560 households a year. However, 180 of that capacity was seasonal shelters. So we were operating a lot of, imagine like church basement, volunteer run, cold weather shelters. In May 2020, we were down to a capacity of 160 households. A number of those volunteer operations ceased. People had a lot of health concerns, and a lot of spaces, especially that were more congregate, really had to wrap their heads around the public health response that was going to be needed. And I appreciate your comment earlier. I think our network of providers, in conjunction with what economic services did with the hotel and motel program, really was an investment that, saved a lot of lives, and I think really helped in our overall response as a state. So then in February 2024, we were back up to around 550 households. You'll notice though that we have much less seasonal capacity. So we have a lot, we've really made investments in year-round capacity. And again, we're just seeing less of that seasonal model for a number of reasons. I think the demands of this population have gone more complex for what was really supported by a volunteer network of seasonal shelters in the past. And I think some of those health concerns linger for folks that just weren't there a couple of years ago. Where we are right now, and actually this is it should be 656, and only 70% are seasonal. So we've seen a 34% increase in year-round shelter capacity since 2020. So the past 5 years, we've increased that capacity by 34% and 20% just in the past year. So while it is, to your point, Senator, 656, on one hand, it may not be seen as meeting the demand. On the other hand, it really has been an investment that we are seeing growth, and we do have a number of projects also in the works. And there are some that have been that I didn't even put on here that have been sort of previously committed to. Upper Valley Haven, Groundworks, Libby Bennett was here yesterday. She alluded to the fact that they have shelter projects hopefully coming online next year. Champlain Valley Office of Economic Opportunity is going to be taking over the state-run shelter in Williston and then working with Champlain Housing Trust on a permanent location. Champlain Housing Trust and Spectrum Youth and Family Services is going to be opening a shelter in coming months for young adults in St. Albans. And then we have a number of other projects that are underway across the state. And, you know, these are significant undertakings. They're real estate transactions, they're significant renovations. So we don't necessarily want to get ahead of some of those processes, but it is something that the department and the agency are committed to doing and really regularly engaging with providers if they think they can expand.
Quick question, should H91 go in to law as it currently exists? Would those negotiations and contract negotiations and mortgages, et cetera, move to the CAS?
So a majority of that work is currently held with Vermont Housing and Conservation Board. We did with one-time funding last year. We were able to support some projects, although again, we're working with Vermont Housing Conservation Board because they really have that expertise. I think the dynamic that folks brought up yesterday is it can be a long process of construction and acquisition. And so when there is a project that comes to VHCB, they work closely with us to get a sense of like, is this something AHS is going to invest in? Is this the right size? Is this in a community that makes sense? You know, if somebody, I mean, this is outlandish, but if someone said, we're going to build 100 family shelter in Addison County, AHS would say, we don't need 100 family shelter in Addison County. Like there are other projects that make more sense. So we work together with them as they review applications. And then we're able to have that in our mind as we look ahead for funding so that we can make an appropriate budget build or make decisions regarding our budget so that we then have operating dollars, because that's where our funding comes in. And I do think that that is one of the questions that was raised yesterday of if now that decision isn't made statewide, what does that look like operationally? You know, I think that it's a question to be solved. I think it's solvable, but it would be a change and it would then require potentially talking to five or six more people or different people instead of a statewide.
Okay.
Thank you for sharing the growth over the last 4 years. It's really helpful and I really appreciate this. It's great. And I just have to underscore, I'm embarrassed that I didn't know the number 192, which is woefully inadequate for Chittenden County. I mean, I am stunned and I wish I had known that that was the number that just would have helped me understand what's happening. So I can think of 193 folks just down the street from where I live. So, yeah, I mean, wow, thank you.
Oh, I think that.
That's it.
This is I think we're done.
And you're gonna send us the slides that you
Yes, I'll send my revised
provide. Yeah,
version. Thank you for the follow-up questions today.
This is all really helpful, all this, the sort of getting the administrative look, how things are done, and, so we can do a comparison with what's in the bill. This is really terrific. It is Sean Gilpin here? Yes. Yeah. All right.
I am. I'm here virtually on the Big Brother screen here behind you.
Well, welcome. And so why don't you introduce yourself for the record, and then you can help us out with your testimony. So, we already introduced ourselves around the table. Were you here for that?
I was, yes, thank you.
Okay, so we don't need to do that again. And so go right ahead, Sean. Thank you for being.
Certainly. Well, good morning, everyone. It is still morning, just barely. Hello, everyone. My name is Sean Gilpin. I am the Housing Division Director at the Department of Housing and Community Development, at DHCD for short, and we are a part of the Agency of Commerce and Community Development. We work very closely with all the folks that you've listened to earlier today, and appreciate all of their work. And we tend to be, I think, ideally a little bit upstream from the work that you've heard about, trying really hard to coordinate about the development of housing and that the development of housing units and housing programs to make sure that we actually have places for people to go. So my understanding was that there was interest in learning a little bit more about how our Vermont Housing Improvement Program, affectionately known as VHIP, sort of meshes in with some of the work that you've heard about already. Is that an accurate?
Yes, that's accurate. Thank you.
Okay. Of course. So one of the and actually, if I may back up a little bit, the housing division at DHCD historically has been composed of two people, myself and one other gentleman who oversees the mobile home park registration program and the various administrative authority that we have over the activities in mobile home parks. Since COVID, we've expanded dramatically in our programmatic nature, are now running a couple flagship programs, or what I would call flagship programs, namely VHIP and also the Manufactured Home Improvement and Repair Program. And I bring that up because, again, both of those major programs we see as significant homelessness prevention programs. Manufactured Housing Improvement and Repair, MER, deals a lot with repairing, as one would imagine, the mobile homes that are around the park, or excuse me, around the states. Within mobile home parks, it's provided an awful lot of resources to folks who would be, or frankly are on the verge of homelessness because of deteriorating housing, and we keep them housed in their homes, in their communities. VHIP is a different but similarly minded program. Through VHIP, we provide relatively small grants. Right now, where our average award is $38,000 per unit to bring uninhabitable housing back into habitable status. So this is actually a program that's been it was pitched for a number of years before the pandemic fell upon us. And during the COVID, sort of the peak of the COVID response period, we received federal funding and ended up utilizing some of that to provide these grants to private property owners to bring existing buildings back into habitable status. During the height of COVID, all of these units were required to be rented to individuals who are exiting homelessness. We have, since the program has evolved a number of times, we're seeking base funding this year. so that we can maintain our efforts. We work through the 5 homeownership centers throughout the state. So it covers the entire state. And these grants go into bringing units back up to code. And it requires an affordability rental period of either, there are 2 options. There's an option of 5 years of affordability and serving a household that has exited homelessness or was experiencing homelessness before the lease, or a 10-year option where the rent has to be at a rate that's affordable to somebody who is eligible for a Section 8 voucher. And that's a 10-year affordability rate. These grants are between $30,000 and $50,000. So a relatively small public investment. We've typically seen about 100% match. We require 20 for these units. And to date, again, the program has gone in and out of funding opportunities. We've utilized a lot of federal funds and had to jump between different pools to make sure that we're keeping things going. We have almost 600 units completed to date, and another 470 on the list that are in the works. About 80% of those units are currently housing people who were experiencing homelessness. The others are all taking tenants off of, or potential tenants off of the Section 8 voucher list from the Vermont State Housing Authority. As I think was noted at the beginning of H91, we're having an increasing struggle with finding appropriate and helpful places for people who have a Section 8 voucher to actually find a place to utilize that. And unfortunately, over the past several years, we've relinquished a number of vouchers back to the federal government for lack of the ability for tenants to find a rental unit. So this program is bringing units back online for a relatively small public investment with an affordability criteria that tends to be reasonable for most private property owners to improve their properties, and focusing heavily on places that have access to transportation in our downtowns and other general smart growth principles. So I'll stop there and open for questions, because I'm sure that we could go a lot of different directions with this.
Thank you for this. I know we've been looking at VHIP down in appropriations, and I've been supporting VHIP. My question of you is, what is your relationship with AHS, VHCB, both the homeless environment world and the housing environment world? What role do you play in connecting or help making those connections? Or with the cash? And do you work with local community services? Can you do that?
Sure. Thank you for that. So speaking specifically of VHIP, obviously we have a lot of relationships with.
Well, you could be with both. I'm not
Yeah.
separating out one or the other.
Specifically with these programs, so we require that folks, program participants who are interested in the 5-year option of engaging with homeless service provision, they have to go through coordinated entry in order to get or a domestic survivors of domestic violence organization or a refugee resettlement organization. So that's kind of the 3, and the DV survivors often don't always show up on the coordinated entry lists because of privacy concerns, obviously. So those are kind of the populations that the property owners who engage in VHIP for the 5-year are required to be involved with. We meet with all of our work. We actually work closely with AHS generally, and especially OEO and DCF, to throw a couple more acronyms in the pot here. We work with them closely on several different councils and several different task forces to make sure that our policies are aligned with what they're seeking. The VHIP works through the 5 homeownership centers. So just for context, that's Champlain Housing Trust in the Northwest, rural edge in the northeast, down street in sort of the central, now Cornerstone, formerly NeighborWorks of Western Vermont, sort of on our west coast, if you will, and then Wyndham and Windsor Housing Trust in those two counties. And they actually are, we regularly have meetings with them and the coordinate or the continuum of care organizations. I'm sure COC is an acronym that you guys are familiar with, homeless service providers throughout the state. So we have regular meetings with both of those groups to sort of facilitate communication and make sure that our property owners, which I can't stress enough, these are these are private property owners in Vermont who see a role for themselves in addressing some of this issue. Obviously, they're not necessarily always mission driven or not for profit, but they are individuals who have assets that are interested in being part of the solution. So we work with AHS and the continuum of care organizations on a regular basis to make sure that our communications for referrals are as efficient as possible. We've worked with them on crafting the policies for this program, and we're all about continuous improvement. So we'll be, we're changing, tweaking the role of or the expectations on our property owners on the regular. So I would say our department definitely works with Lily's team and Commissioner Winters as well, and we have regular meetings and conversations about how best to facilitate the matching, the pairing of individuals with units. I think a big struggle is always ability to pay. So the availability of a voucher and service needs, which I know it was mentioned earlier. There definitely is a spectrum of folks. Some folks literally just need a key and a voucher to cover rent, and they'll be back on their feet in a little bit. And other folks, obviously need a lot more service intensive assistance to bring themselves back up, and trying to make those connections is always a challenge, but it's one that we're engaged in on the regular. We did actually, I believe, a number of individuals recently were housed out of the Williston shelter into VHIP units, and we continue to try to prioritize the folks who are most in need and most ready to move out, which is, obviously a Venn diagram that's a difficult one, but that's our goal.
We like Venn diagrams.
Yeah,
Yeah.
love it over them.
Sean, thank you so much. It would be helpful if we could get a quick summary of your testimony that we can post online. Can you do that for us?
Certainly. I can. Is a narrative, or would you like statistics? We're actually working really closely with Agency of Digital Services as well to make sure that we're being as transparent as possible about where these funds are going. And I'm looking right now at a new, as of last week, a new Power BI that one of my stellar teammates has put together. That's pretty impressive. So I'm happy to send that your way. It's a little statistic heavy, but it's visually appealing.
Yeah, that would be helpful, and just the context too for
Yep.
what the programs are doing and who's eligible. That information would be very helpful. Thank you.
Absolutely.
All right, terrific. Other questions, committee? I think we're good. We are going to end this section, part of our committee meeting, and take a short break. And then we will be back. And I thank you very much, Sean, for being available to us. Thank you all. This has been great.
Anytime.